Hi there, my name is Gabriela and I'm going to present the role of different professions and the interdisciplinarity in a genetic counseling service. This paper was made by me with the help of Isabeli Russo Lopes and Julia Ayumi Ikeda Kawasaki, and our advisors were Renata Grossi and Wagner José Martins Paiva, because they are teachers from different fields of the program, so they both advised us. So about our program, the Extension Program Genetic Counseling Service from State University of Londrina is a free service, and we attend to suspected genetic disorder or couples with difficulties to have children. Both of these groups are referred to us by doctors or other health professionals, or they find us through the website or through the Facebook. We have a Facebook page and a website that explain a little about our work. So sometimes people call us and ask for some services. So the objective of this presentation, we wanted to report the intersection between the different fields of expertise of the extensional program and indicate the importance of interdisciplinarity to a humanized approach. So we used our experience. We are reporting our experience through 5 years of collaboration. And to show a little about our work, we're going to present the steps of our service, but only the steps of our service offered to the community, because we also have some research works that have not direct impact to the community, but we can understand, we notice that it has a contribution to the academic and an indirect impact at the community. The first step of our service is forwarding. As I said, patients are referred to us. We receive them at the Specialties Outpatient Clinic of the University Hospital. The patients are welcomed by us. Our team is a combination of pharmacists, nurses, dentists, psychologists, or doctors, and they are mostly students of these areas yet. Our team is all trained and supervised and equipped to receive the patient and collect their personal data and the family history. And we have at least one collaborator to each integrant of the family. The second step is the collection. The sample of peripheral blood is collected and forwarded to the laboratory team of Human Genetics Laboratory, and the interviewing data is forwarded to the clinical genetics team. We have 9 teams. Each one of them is prepared to a specific work, a specific service to offer to the community or to the collaborators of the program. So the interview is composed by questions about pregnancy, genetic disorder, child development, and also about social information such as education and financial situation and those types of information. The third step is the analysis. We have the blood samples analyzed by G-banding and karyotyping techniques. Those analyses are made by biologists and biomedics for its laboratorial work, but it also can be taught to pharmacists and doctors. And the personnel data is forwarded to doctors, nurses, and pharmacists, usually to doctors or students of medicine, that provides us an individual study case that will help on the next step, which is the devolutive and psychological support. This fourth step is divided in two different moments. First moment is devolutive. During devolutive, the results are explained to the patient, and we refer to another treatment or another resource that sometimes the family does not know that they are able to get. So the devolutive is done by doctors and biologists certified as genetic counselors. In our program, we have a biologist. He is certified, he's a genetic counselor. And after this devolutive, we have the psychological support, which is really different from a therapy because we use psychoeducation and we offer psychotherapy, but what we want to know, what we want to do is guarantee the comprehension of the patient about the result. This moment of psychological support is done by psychologists and social workers because sometimes we need information about social references that can be more clarified by social workers. The fifth step doesn't always happen to our patients because it only happens when we notice a need for follow-up or continued support. In those cases, we offer psychotherapy or we organize a singular therapeutic project. This singular therapeutic project is organized by a psychologist and a social worker. We visit the patient at home or at institutions that they receive treatment, and our focus is on the genetic demand of this person, which means that if this person has anxiety, depression, and other needs of psychotherapy, we do not offer them a psychological monitoring. We offer them a referral to other professionals that can help them with those demands. Our only demand is the genetics one. So, to conclude, what we can affirm, we notice a lot of benefits of different professional collaboration and the interdisciplinarity services because we can have a plural understanding about case, and the dialogue between different knowledges provides us a humanized approach at genetic counseling because with this dialogue we can look the patient as a complete person. We can notice aspects of its life, its routine, its comprehension, and we can offer them a complete work and guarantee more chances to have a treatment and maybe have a life with more quality. So this is our team, and we have a really big team. It's around 80 people, and a lot of them do not work with the patients directly because, as I said, we also have research works and services. So a lot of them are researchers, such as some of us that have done this presentation. And if someone is interested about what we do and what we offer, we're online, we're on Facebook. Our name is Serviço de Aconselhamento Genético da Universidade Estadual de Londrina, and we will be really happy to have a conversation and show a little more about our work. So contact us, and I hope everybody enjoyed all the presentations of this event.